So, very, very good morning, everyone. Namaste to everyone. Today has been a very, very special day. We have been discussing about it for a long, long time to get our special guest, Dr. Erika, with us. We all live our life and we think that my life is not moving on and I'm stagnant. And we always think that even though I'm giving my best, why is it that the life is stuck? I'm living, but I'm not living. And that happens because our subconscious programming of the childhood is very, very strong. And during that time, what we have perceived as trauma remains with us. There are different ways through which we can release our trauma. So, as much as what we had perceived as trauma, and we store it in our physical body, we do not realize when we say that, oh, I dance and shake it off. But that's what Dr. Erika and their team at TRE says that shake it off and you can just let go of your trauma. I had never heard about it that physically one can release trauma because I knew how to release it through the heart song, how to release it by clearing the energy field. But during one of our workshop of past life, Yolande introduced TRE exercises to us, and you can actually do physical exercises and trigger those points in the body. We were in a lying down position and we would literally like shake off. And the body's wisdom will be in charge and body used to let go of the trauma. So let us understand it from Dr. Erika and let's invite Dr. Erika. Hi, Dr. Erika. Good morning. I know it's 4:30 a.m. for you in South Africa.
Good morning. Yes, it's quite early and still dark, but it
Yeah.
is very nice to be with you.
Thank you. You bring light in people's lives, so I do not think it's ever going to be so dark outside. Doesn't matter because your light shines.
Oh, thank you so much. It's really, really great
So
to meet you.
thank you so much. So Dr. Erika is not only a TRE expert, she is an homeopath also. I think let Dr. Erika introduce herself because there was so much for her introduction. I thought it would be better that if you speak about it.
Good. Thank you. I'll do that. So I am a medical doctor. I've been in practice for more than 30 years. And then I studied homeopathy as well. And part of my journey was when I realized there's much more to medicine, and there's for me a difference between healing and treating. So I've had a long journey and worked in different places, but I also had a lot of experience. After I studied medicine, I actually started to specialize in psychiatry.
Wow.
So I didn't finish it, but I've had a very broad picture of the human trauma and the mind and just all the emotional problems and just the way that I feel people are stuck in just stress and trauma. And then and in the practice, that's what I saw, that people would get better. I'll treat them. And then they'll come back because there was a huge incident or there was stress and trauma again. So for a long time, I did a lot of other things. I did transactional analysis, different other modalities and mindfulness. And I was really looking for something to help me understand it better, but actually as a tool to help people to really, really get better. And then I met Dr. David Baselli in 2010 when he came to South Africa, and I did my TRE training with him, and then he invited me to actually become a trainer. So the TRE training is part of the International Global Certification Program. And since then, I've been doing a lot of workshops, doing a lot of TRE, been training people, just doing it, and just see that there's been huge transformation in people's lives. And the beauty is because I feel it's something that you can actually teach people, and it's a tool that they can use themselves.
Wow. Thank you so much. So, Dr. Erika, can you just throw some light on what exactly TRE mean and how do you initiate the procedure?
So TRE stands for tension and trauma releasing exercises. So it's a
Okay.
long word. So we, in short, it's TRE. We call it, just say TRE. So the idea is that you do a few stretches to initiate a tremor mechanism in the body. So to give you just sort of a explanation of that, we know that animals in the wild don't suffer from any diseases. I mean, I live in South Africa close to the Kruger National Park, so there's lots of wild animals from elephant to zebra, you name it. So they don't get diseases like we do, and that heart diseases, diabetes, and all the chronic diseases that we actually have, including, for instance, cancer. But animals in captivity and pets get the same diseases as humans. So the
Right.
connection was made that because they still use the inherent mechanism to reset the stress button all the time. And that is that muscle tremor that we always see they have. There's always something, some part of their body that actually is moving. So TRE is built on that same principle because we use this, our stress brains are exactly the same as the ones in animals. We just have a human cognitive brain as well. But if we look at the stress response and the survival response, it's the same brains that we share with animals. And the connection is then that it as a strong signal to the muscle even before our stress hormones are released. And that is part of our genetics. So, what we then do with TRE is we stretch and we allow the muscle to start a fine tremor mechanism that helps the body to release all the stress and then the stored trauma that's been stored and built and that has built up in the body.
Okay. And everybody can do it, or is there any restriction for it?
Anybody can do it. It's really something that is there for everybody. And in my practice, I've seen from children to old people doing TRE. So it's really something for everybody. There are a few restrictions, with anything like an exercise. If you've had a big operation, you're going to wait a while before you do it. And if I work sometimes with more complicated cases, and that's people with severe, for instance, say psychiatric conditions. But there's not a contraindication for any, it's really just I want to say the logical reasons why sometimes we are going to refrain from it. But apart from that, it is for everybody. And I feel it is so important because it is part of our genetics. That's the way that our body has encoded a way to release our stress and trauma.
So, Dr. Erika, you said like you work with some psychiatry patients as well. So, does that actually help for the brain chemicals also to be balanced apart from releasing tension from the body and the trauma and stress from the physical self?
Yes, it does. It helps the body to bring back the balance. So it will change our neurotransmitters, the signals in the brain. And if we think about serotonin and dopamine and all the others, it does help to balance that as well. And it can change because we know if we look at functional MRI scans. That if somebody is really, for instance, has got post-traumatic stress disorder, there's a part of the brain, the what we call the hippocampus, that actually shrinks a little bit. And after doing TRE, it can return to normal. So it has a huge impact to help the body and the brain to restore to normal and to balance.
I mean, just out of curiosity, I'm asking, there are certain disease, where, for example, Parkinson's, or where people actually tremor, and you want to stop it. Like, how do you, can you help them as well? Like, because this is also a tremor, and here you initiate tremor to help people release tension. How are both the conditions very different? Where in one condition it is a negative sign, and in one it's a positive sign because it's actually helping you to release the stress and tension.
Yes, in Parkinson's, there's this part of the brain that eventually goes into a pathological tremor. No, so it's a tremor exactly like you say. So it is now part of a disease. My thinking and the way that I've seen it, if I work with Parkinson's patients, is sometimes it is just like over a long period of time, the stress and the trauma that's really got stuck in a part of the brain, and then you get this tremor that is debilitating. So we do then work with them and introduce TRE, because we also know that when they are stressed, their tremors are much worse. So what we see is if they then do TRE and they can begin to, over a period of time, regulate that process, the Parkinson's tremor and some of the other symptoms are really much less. So it helps a lot. We also use TRE in these nice studies that's been done in TRE in patients with multiple sclerosis. So a lot of the neurological diseases respond very well to TRE.
And is there any specific diseases that TRE is specialized and that you use it specifically for those diseases? Like, are they more lifestyle disorder diseases like diabetes, blood pressure, and all, or the more neurological disorders or any?
I use TRE for all the different symptoms and diseases that we get. Definitely for more lifestyle diseases, diabetes, hypertension. And if I think about hypertension, if you do TRE with somebody that just started with hypertension, it often can turn it around in a few weeks' time. If it's more chronic and you've been on blood pressure medication for a while, it will definitely regulate your blood pressure better. Neurological diseases, like I say, the chronic diseases like Parkinson's and multiple sclerosis, and even for patients with disabilities or accidents and with some specific neurological fallout, we use it with them as well. And then for the daily stresses, trauma, post-traumatic stress disorders. So the thing with TRE is it works on the emotional level, and also and it works in the body on the physiological level. So it works on both to help the body to bring back the balance.
Okay. And normally, how many sessions are needed for a client to let go of the trauma completely?
There's not a specific recipe for that. We usually, when we start, we begin with 6 to 8 sessions. But it is a life. We have stress every day, so our stress response kicks in without we even knowing it now on a daily basis. If it wasn't for that, we wouldn't have survived. So it's really something that you do. It becomes part of your lifestyle. But if somebody had a severe traumatic incident, we're going to go for 6 to 8 sessions, and it's usually because when people feel comfortable with the process and they begin to trust it and they see it's such a simple tool and their body is really just, like I say, tapping into their own neurological system and genetic encoding, then it is something that people love to do themselves. So that is part of it. We facilitate until somebody is really comfortable and they continue with doing TRE themselves.
So when they learn it, can they actually practice it every day?
They can practice it every day. They can practice it
Okay.
every day. When we do a workshop and we do the training, it's very practical. So we do 2 TRE sessions a day. So it's almost like in a bit of a fast pace, but it's a very nice connection with your bodies. And it's a really, that's the best way for me to think. You really begin to feel your body and have just that correspondence between realizing your body can take care of you. It's one of the things that the question often comes up, how often do you do it? We say 3 times a week, because it's like exercise as well. There's not really progress if you just do it once in a while. So it's a good thing, but you can do it every day as well. And you can also do it after you've done some exercises. It's part of, just a really nice, relaxing, do a TRE session after you've exercised.
Okay. And normally, what is the procedure if somebody wants to learn it? And when is it that they actually can practice it on themselves? And when is it that they can actually do it on somebody else?
So when I do a training, then people can do the training just for themselves as well. And I often have that people say, I just want to do TRE for myself, and they come and they do the training. The nice thing about the training, it's really practical, and it is initially really just something for yourself as well. But in the training, you learn all the theory as well, and the important aspects of understanding the brain and the different types of trauma. And we cover things like a neuroplasticity, and it's such a wide, interesting topics that we cover. So people can do it for themselves, or they can then decide they want to continue with it, because there's a module 1 and then there's a module 2. And the module 2 goes more into then sometimes working with some interventions as well, to help somebody if they really feel, there's a part of their body, sometimes old injuries or just really deep trauma that feels stuck. So, and then after you've done your module 1 and module 2, both are 3 days, then you can just do case studies. The case studies is usually 2 individuals that you take through a TRE processes, and then in a small group of people. And once you've done everything and you understand it, you get your international certificate to say that you're a TRE facilitator. But if you do just the TRE 3 days, you can do it for yourselves, but it is part of the international training. So you can just anytime continue and do your module 2 as well and your case studies.
So, if you do only first 3 days, then you can do it only for yourself, but you cannot help people to do it.
The first 3 days is mostly for yourself, but you will, because in the training, you begin to work with people as well, 2 by 2. So if you feel comfortable, we usually say to people, just if you've done the training, just continue with TRE for yourself for about 4 to 6 weeks, and don't do it with anybody else. But after that, you can begin to, with people that not complicated cases. Just start to introduce it to people. After the training, you can do it with other people, or you will feel familiar enough that you can take somebody else through the TRE process.
And just want to ask that normally when people release trauma, there is a lot of crying, a lot of emotions comes out. There are a lot of words which are trigger points, which are very, very hurtful if they have gone through some abuses and all. So, how is it different here? Like, because here it's a physical trauma and physical release of the trauma and the stress. So you actually shake it off. So I wanted to ask, like here also, like, do people experience those emotions or they don't experience emotions? Do they also vent it out and cry it out, or it's only at a physical level, and from physical it helps the emotional? How exactly does it work?
There can be emotions when you do TRE. In the stress response, I'm looking specifically, like we said, the two brains, the brainstem and the limbic system. Then the limbic system is the mammalian brain that we share. The emotions are in mostly in that part of the brain. So when you do TRE, it is really shaking it off. You shake off the stress and your body gets rid of that. And because the 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 body feels safer, or the nervous system comes to a place of safety, often deep emotions can then begin to surface because it's part of the release. So it's not part of a re-traumatizing, it's part of the body's completion of the stress response. So there can be emotions, there can be crying, they can be incredibly laughing as well, which is really nice to see. With people, it's like that freeing laugh, that reflex laugh. But there can be, sometimes a bit of anxiety as well. But usually, when the body is part of that process, and we teach that as well, how to absolutely go into your breathing pattern and help the body to safety so that it's safe to release the emotions as well. And once that is done, it's a wonderful completion of, and a deep healing that takes place. So the important thing that we explain is it's not a re-traumatizing. It is really part of the final release of something that has been stored and stuck in the body.
So, do they actually go through those painful memories? Do those memories come at the surface for them to recognize and identify that those memories were stored as trauma? There are many times certain traumas people are aware, certain traumas people are really not aware of, and both requires to be released. So, is those memory recall actually helps them to identify this had been trauma, they were being traumatized during that time and they've released? What happens?
It is possible sometimes to remember things. The difference for me in theory is the fact that the body sometimes releases a lot of things by just tremoring it off, and you don't even have to know what it is. It's the body's own intelligence. But then sometimes deep a memory will come back, sometimes afterwards, or the next day, or dream about it. But it is because the body has released it and the body is in a better place of safety. It is not that traumatic to remember it. It's just a memory that comes. And it's almost like in that I say, it is now safe enough for the body to release it because, or remember it, because the body is busy processing it and releasing it. Sometimes in if there was severe trauma in a life threatening disease, when somebody was really almost, dead, or something really, really traumatic, like I say, the life threatening types of situations, sometimes the person will then, when they do TRE, go to that situation. And then that is when it's nice to actually know to help safely facilitate it and help that person to just break it up in little pieces. Do theory, stop a little bit if they feel, it's a bit overwhelming, and then continue to do it themselves. The important thing is we teach when we do theory, and I teach it. We teach that person to facilitate their own process and to just stop when they feel it's a bit overwhelming, and it's to give them the power back. So there's different situations, and everybody is so unique. but it has the ability to go very deep. I have seen that people sometimes remember it like a birth trauma, because everything that has happened to us since conception and birth is stored in the body on a cellular level. And TRE has got the ability to help the body to release all of that.
Okay. And any kind of abuses gets released, whether it is physical abuse, verbal, or emotional abuse, or sexual abuse. Is it that all kind of abuses can get released through TRE? Because when people have gone through those abuses, the same person or the same situation actually triggers you and you feel vulnerable. So, with time, as you release the trauma, your point of vulnerability reduces here.
Definitely, that has the ability to release all the different types of abuses. And the important thing is to feel safe with, if you work with somebody, we say if the facilitator and the environment is safe enough, the body will really release all that type of abuses. And there's different techniques that we also, or just sometimes ways that we adapt the process if there's a specific abuse and we know it's really, really traumatic or hurtful, to help that, for it to be safe. And what I often see is people begin to change, because when you are, when you're still in the victim state, and you begin to change emotionally, it is interesting to see how people change and begin to make better decisions and feel stronger and empowered. And it really helps that deep process of healing after abuse.
Okay. Before I ask more questions, is there anyone else on the group who would like to ask questions? Because Dr. Erika and Yolande, they are especially coming to India in May to teach level one of TRE, so which is the 3-day module, right, Dr. Erika?
That's right,
Yeah, so
yes.
they are planning May 7th to 9th, right, in Mumbai.
Yes.
Yeah, May 7th to 9th, they are coming to introduce. Till now, India does not know TRE. They are the first one to bring TRE to India to help us to release our stress and trauma. So, if any one of you have any questions of how TRE helps and how it works, please feel free. You can unmute yourself or you can raise your hand, and our team will help you to unmute and you can ask question directly to her. Anyone in the group who have any questions, please ask because she's the right person. Afterwards, if you'll ask us, probably we will not be able to explain you because I have not learned TRE myself, so I do not know. Uh, I have experienced it and I have done it, and I can say it's really nice and it's really wonderful. Anybody from the group has any questions regarding it? Because today I cannot see people here. Erika, can you see here? Because we're out of
Yes,
India and
I
Can
can
I?
see.
yeah,
I can.
please.
Is there Maya that wants to ask a
May
question?
I?
Yes, Maya,
It's
please.
Vijaya. Okay.
Okay, Vijaya, yeah, please.
So, hi, Erika and
Good morning.
Yolande. Thank you so much. Good morning. And thanks to Sangeeta for bringing you out here. I love dancing, and it's like life for me. But recently, like, I see that I'm not able to, the ankles start paining. Is it a point of release? I stop it because there is pain in the ankles only when I dance.
That and because the interesting thing about TRE, it really works on the physical trauma as well, meaning that your ankles are, probably telling you that there's a bit of trauma and overuse there. So it's very interesting, and I've got some interesting stories about dancers and when they do TRE and their feet begins to have the tremor mechanism. So it might really help because if you love dancing and you do a lot of dancing and it's only your ankles, it definitely shows that there's a bit of overuse of the ankles. And when we do the stretches in TRE, we actually begin with the ankles. That's the first stretch that we do. So that will be interesting to see.
Thank you. Thank you.
I guess Maya and Manjusha also had some question. Maya, can you come next?
Hi, good morning, Sangeeta ma'am. Thank you for
Good
bringing Dr.
morning.
Erika, and it's wonderful. Okay, I have a question like her only. I love dancing, but I have some back problems due to which doctor has told me not to dance. So how can this help me out by doing TRE, and how can you brief little more into it?
So when we do TRE and we do we call it, it's tension and trauma releasing exercises. But what we do is we do stretches to activate the tremor mechanism. And we work within everybody's physical limitations as well. If you've got a back problem, if you do the stretches, you're going to be very careful not to do any injury to your back or any part of your body. And it is very nice to see because often the tremor starts more in the legs and in what we say the psoas muscle, and then it often moves up to the back and releases a lot of stress and tension and pain in the back. So it is always interesting for me to see how mobility changes and the body's just, they're almost like in the muscle movement begin to come back. So it might really just be interesting to see and follow the process for yourself and see the difference that it can make, because it's a definite possibility that it can help.
Oh, thank you, doctor.
Right.
I think Manjusha, you had a question. Manjusha, can you please go ahead? Is Manjusha there?
Manjusha said she's got sore
Yeah,
throat
I,
and some
yeah, I have
flu.
I have a very bad voice, so that's why I had put it on the chat actually.
Can someone, Dr. Erika,
She
can
would,
you read it from the chat and answer?
Yeah,
If you
basically I was
can
just
read
asking
it
whether it could be
loudly.
done online.
There are online theory courses. I personally don't do it online, and I think Yolandi and everybody that's done it with me agree. It's such a personal process, and you learn such a lot of valuable things when you do it in person. And also the connection of of a group and seeing other people's processes when you begin to facilitate, that I don't think it is really something that I'll ever teach online. Advanced courses, when somebody has done theory themselves, but the basis and the learning and the introduction, I feel one-on-one is invaluable to do it when in a real training and not a online training.
Okay, I do understand. I just needed that clarification. Thank you so much, Ted.
Manjusha, I think it helps you to release it from physical self. So when your body is moving, and I mean, whatever I have experienced, even I would add on to it, that there are times you require someone to help you anchoring your energies. And only
Right,
somebody who is an expert and who understands can help you to anchor your energies. So it's
right.
always advisable to learn it, because it's not that intellectually you are understanding it, you are actually triggering that mechanism in the physical self. So that point of time, someone's guidance, mentoring does help. And yeah, you do feel very strange, because when we used to do it after our past life class every single day, we used to wonder, because how your body is actually moving from left to right, and how suddenly one day your hands are shaking, one day your legs are shaking, and you find it too funny. Like initially, I used to find it funny, and I couldn't understand. And because we are so much used to our way of thinking, intellectually identifying why this happened, what is my learning, where do I go ahead, and suddenly my body takes charge of everything, and my body is in charge and is moving. So 100% I would also advise you should do it in person wherever and whenever they are.
Yeah.
Right.
Thank you,
Thank
Nana.
you so much. Thank you, Sangeeta, for that explanation.
Thank you. Is there anyone else who has any question? Dr. Erika, would you like to share some details with them? When are you guys planning, and how, if anyone is interested in joining, how can they go ahead with it? Or
We
whom can
will.
they contact?
They can contact us. We will share the details with them. Yolandi, did you want to ask something? I saw your hand raised.
Yes, good morning, everyone, and hi, Sangeeta. I just
Hi,
wanted to
Yolanda.
also add on to stress, especially our day-to-day stress that we go through. And normally it goes through into your neck and your shoulder. You go for massages, you drink pills and everything, and that doesn't really release that stress. So I found while doing TRE, even a daily stress out day, the environment around us, it helps you just before sleeping time, just to sit with yourself, release a little bit. And it does release that tension in the shoulders and in the neck. And then also with your sleeping. So that also puts you in a nice, calm sleeping state. And the next morning, you're more refreshed and better. Also, with muscle pain, it also releases that muscle pain for some people that gym a lot, exercise a lot, and also with the dancing as well. It helps a lot with that pain relief.
Thank you,
Thank you.
Yolanda. That was very, very valuable. And anything else you would like to share, Yolanda? Because you introduced TRE to us. So.
Yes, I know that theory changed my life as well. It's another way of thinking without thinking. And while Dr. Erika explained to us and showed us this beautiful way of releasing trauma, sometimes we are not ready to explain something, or sometimes we don't even know what is bothering us. But by using TRE on a daily basis or 3 times a week, or sometimes even when you get busy, without it also slows down your mind as well, and it brings you back to the body to be grounded. And I feel that it's a beautiful way of just releasing. And it will be amazing for everyone to join us in India in May. We did send out, we have a flyer. Sangeeta, if you can share it on the group with people, there's a link.
No,
You can.
we definitely will share it with our Thursday Thought Clinic, but it would be nice if right now on the chat, if you can share your contact details and everything with them, because if there is someone who is out of the group, can also get your
Yes, we'll do.
contact number and can contact you. And if you can share certain details on the chat with them, it would be really nice.
Will do.
Yolandi, yes, Yolandi, well, you can share my phone number as well. My contact details.
So. Yeah.
Yes,
So
so we will.
definitely will put. Is there any other details anybody from the group would like to ask? Okay. So let Yolande share the all the details on the group, on the chat. Anyone who's interested, please feel free to call them, either Dr. Erika herself directly or Yolande, since they are coming in May, and I will be traveling to US, so I know I will miss out on your workshop. Otherwise, I would have definitely loved to join, because I really love to learn new things, and I would have definitely loved to join. Probably someday I'll come to South Africa and learn it from you,
Oh, that's
or
one. That will be.
your or your next visit. For all of you, do take advantage of it because I have done it personally and it does definitely help a lot. So that's what I can tell you guys. And Dr. Erika, thank you so much for thinking about India and getting a wonderful technique in India for all of us. And thank you so much for joining. And it was lovely to have you on our group and lovely to share all these things because many times we actually forget what God has gifted us from birth. And I mean, we do see on the road the dog suddenly starts moving in a way, and we find it very funny. But we do see animals doing it, but we have forgotten to even question why do they do it and how does that help? And just to realize that there are certain simple things, if we actually practice it every day, probably the life would not be so stressful and we all can live a very, very happy life because ultimately everyone has only one goal to be happy in life. And we will be able to be our best version of ourselves. So, thank you so much for joining us and enlightening us with all your knowledge. And it was lovely to have you here and a warm welcome to you in India as and when you come here.
Thank you so much. Thank you.
Thank you.
Thank you to
Thank
everybody.
you.
It was lovely.
Thank you. Thank you. See you. See you all next Thursday. We are starting to talk about emotions from next Thursday. If you guys have any particular query about anything, you want us to speak about certain things, please do get back to us. You can either message on our clinic number or on the YouTube directly, and we can take that topic. Whereas now that we have finished 9 gems of theta healing, we understood TRE. Now we will move towards emotions because that is what we had heard from people that they can't handle certain emotions and how can that be handled. So that is what we will start talking about. So we'll see you all next Thursday. Thank you all. Love you all. Bye.